Hello, I'm Dr. Atkin, chiropractor and master herbalist at Family Focus Chiropractic in Holly Springs, North Carolina. And today we're going to talk about my favorite subject, kids and chiropractic. Now we're going to be talking about why a child would even need to see a chiropractor, what conditions chiropractic can help with, and how to get your child checked for subluxation. Now this is going to be a little bit of a longer video. It might be about 7 or 8 minutes, but I want you to hang with me. This video is designed for parents that are really looking for answers in a way that they may have never seen before. And I want to introduce chiropractic as a potential solution for that. So hang with me for these 7 or 8 minutes. A lot of parents will come in and they'll ask, well, why would a child need to see a chiropractor? I mean, they don't get back pain, neck pain, and headaches, right? And the answer is no, usually not. In fact, even if kids did have pain, a lot of times we wouldn't even know anyway. But to understand why a kid would need to see a chiropractor, you've got to understand a little bit about what chiropractic is. And I'm not going to take a ton of time right now to talk about it. Find that in other parts of our website. But the basic idea is that the brain communicates with the rest of the body by sending healing messages down the spinal cord and out through the nerves to the rest of the body. And that's the way that the body heals. Now, if there's interference in the communication between the brain and the rest of the body, then the body can't heal and your child can't function properly. In chiropractic terms, that's known as the subluxation. It means something's causing nerve interference. Sometimes it's the spine being out of alignment, and that interference is causing a problem in the way that the body functions. Now, a child's nervous system is probably just as important, if not more important, than an adult's nervous system. And that's because, as research and psychologists tell us, those early months and years in a child's life are some of the most important developmental times. And if there's one critical stage of life that you want your nervous system working optimally, it's going to be during those early years of growth and development. Now, the next question that people ask is, well, okay, so certainly I can see how nerve interference would affect my child, but why would a kid get a subluxation? It's not like his spine's degenerating or anything like that, right? The answer is no, there's certainly no degeneration happening. But a subluxation is caused by stress, physical, emotional, and nutritional stress. So let's start with physical stress. And that, for most people, begins the day that they're born. Now, 50, 100 years ago, there wasn't a whole lot of intervention during the birth and the labor process. But nowadays, it's almost, like a surgery every time, where the baby's either being pulled out with tongs, sucked out with a vacuum, or maybe it turns into a C-section surgical process where the baby's head gets whipped out. In many cases, the doctor has to actually grab onto that baby's head and pull him out. The doctor learns how to kind of twist and turn things, dip the shoulder properly, and because the bones in those necks are not fully developed, lots of problems can result. So take, for example, how much does a baby weigh, right? Maybe 7, 8, 9 pounds, something like that. So let's say I deliver your child, and I grab that, and then to hand you your baby, I palm your baby by the head, and I gently hand him over to you, smiling and saying, here's your precious little baby. First of all, you knock me out, right? But when you think about it, how much pressure is on that baby's head? 7, 8, 9 pounds maybe, right? The research shows that the average amount of force when a doctor has to engage a baby's head to pull that baby out is 90 pounds. Now, you're capable of pulling something at 90 pounds. You might have to kind of stick your leg up on the chair in front of you to really kind of get some a good base and good traction, but you can pull 90 pounds. That's the average amount of force that a doctor has to use to pull a child out. You'd knock me out for putting 7 or 8 pounds of force on that baby's head, and you won't knock the doctor out for putting 90 pounds of force? Now, I'm not trying to make a villain out of the doctors. They love your children. They do the very best that they can. But can you see how 90 pounds of force might cause some misalignment right in that very first vertebrae in your baby's neck, the atlas, which is right next to the brainstem, putting pressure on that brainstem. And then all of a sudden that baby can't turn his head as far to one direction, which means he can't nurse properly. He's not latching right. Maybe he's not sucking hard enough or sucking right, and that's because the signals that are going from the brain to the tongue just aren't functioning properly. And then all of a sudden that kid has colic, breastfeeding difficulties. Then he's not sleeping right, reflux. Then he gets recurring ear infections and colds, asthma, allergies, food sensitivities. That leads into early signs of autism, and nowadays we got 1 in 38 children with autism. Now, I know a lot of people see those sicknesses as individual and isolated events, but it's all part of a spectrum. I see it from day one, from birth, all the way on up. And regardless of when I step in to help that child, whether it's day 1, month 1, year 15, or when you're 45 years old, that problem leads to a lot of issues as as the years pass by. No, so that's just day one physical stress, right? Well, as our toddlers going around, I mean, how many times a day do they fall on their butts, right? At least 27. They come thumping down every step of the stairs, charge headfirst into your couch, fall from trees, beat each other up. And I like an active kid. An active kid is a good, healthy kid normally. But if that causes some spinal misalignment and some nerve interference, that's a source of subluxation. That's only physical stress. Nutritional stress, we could go on all day, right? Exclusively breastfed until 6 months old, breastfed all the way up until a year or 2 years of age, fed organic fruits and vegetables. We can't introduce grains and other things too early, or we got all kinds of food sensitivities. How many kids have a lot of nutritional stress in their lives? I'd say about every one of them. I mean, they grow up on macaroni and cheese and ketchup, right? What about mentally and emotionally? Not going to go into too much detail here, but kids absorb everything in their environment. Our stressful, hectic lives have an impact on them. So physical, emotional, nutritional stress absolutely can cause subluxation in your child. Now, does that mean that every child's subluxated? No. But I think a lot of them are. And I think that's what's causing a lot of the problems that we've been discussing. In fact, we have kids coming in, whether they're coming in due to birth stress, breastfeeding difficulties, sleeping problems, colic, reflux, allergies, asthma, food sensitivities, scoliosis, bedwetting, sensory and developmental disorders such as ADD, ADHD, autism, dyslexia. That list can go on and on. Now you start looking at that list and you think, wow, this dude thinks he can cure just about everything. But I don't treat a single one of those conditions. All I look at is to see if there's interference in your child's nervous system, and if there is, and if I remove it, then that child's body functions better. And then it's able to heal itself from these various things that we've discussed. In fact, a lot of parents will take their otherwise completely, healthy children that have had some sports injuries and bring them into the office. Lots of benefits can be seen from chiropractic care. Now, how is a child adjusted? Maybe you've been adjusted before and you're thinking, wow, I wouldn't want that snap, crackle, pop happening to my child. But a child is adjusted very differently. In fact, in an infant, I don't use any more force than what you can comfortably place on the outside of your eyelid before it becomes uncomfortable. The idea is the same. Removing nerve interference, whether it be from an adult or the child, that's the goal. But the way that a child is adjusted is so different. That's why it's so important that you see a chiropractor who not only has the experience, but the training. And that's where we've received extensive training and certification through the International Chiropractic Pediatric Association, where we're specialized in the chiropractic care of pregnant women, infants, and children. So the question that should be on your forefront right now of your mind is, does my child have nerve interference? Does my child have subluxation? And the answer is, I don't know, but we can certainly check. During our first visit, we'll sit down, we'll do some paperwork, we'll have a one-on-one conversation about your child and any health concerns that you have. We'll answer whatever questions you may have about chiropractic, and then we'll bring your child in, where we'll closely examine his spine, do some neurological testing. We may do a nerve scan and a muscle scan using state-of-the-art scanning technology to assess the function of his nervous system. Some posture, range of motion. And during that first visit, we'll find out all kinds of things. And I'll be able to put a report together so that the second time you come in, we'll sit down, look at the results, talk to you about what our recommendations are, and then your child will get his first adjustment. And everything will be different after that. We have a very family-friendly office. You're going to love it here. Big kids playroom, very family-friendly. Give us a call. Visit our website. Click on the link below. Can't wait to see you soon.